Today we are going to discuss a very important topic, that is imaging patterns of hypoxic ischemic encephalopathy, right? So the imaging findings in hypoxic ischemic injury, actually it is quite variable and depends on a number of factors, starting with brain maturity, whether we are looking for HII in a neonate or an adult. Okay, so the imaging pattern will vary depending on the brain maturity. And then what is the severity of hypoxic insult and what is the duration? So there are a number of factors which determine the imaging pattern of HII. As far as adults are concerned, so the imaging findings in HII is not that complex. However, in neonates, especially whether we're dealing with a preterm neonate or a term neonate, in those scenarios, the imaging patterns can be quite complex. So main focus of today's class will be perinatal hypoxic ischemic injury, right? So this is something that we'll discuss in detail. So we'll be looking at the pathophysiological features of HII and specific imaging manifestations in preterm, term neonates, as well as in children and adults, right? And briefly, we'll also discuss the role of MR spectroscopy in hypoxic ischemic injury. Okay, so what are the determinants of extent of brain injury in HII? So it is MSD. So maturity, what is the maturity of the brain parenchyma, whether we are dealing with a preterm neonate or a term neonate, and adults or infants. Then severity. So it is whether the hypoxic insult is severe or it is mild to moderate. So depending on all these factors, there will be different extent of brain injury, right? Then duration of insult, whether it's acute, short insult, less than 10 minutes, or a prolonged insult. So all these factors will determine the how bad the brain injury is. Okay, so we'll start with neonatal HII. The adults hypoxic insult we'll discuss later. So the neonatal hypoxic ischemic insult. So this is the most common cause of cerebral palsy and other severe neurological deficits in children. Right. So as I've discussed, the exact nature of brain injury, that will depend how severe the hypoxic insult was and what is the degree of brain maturations. Okay, so whether the patient or the baby is a preterm or a term, so all these factors will determine how severe the brain injury is and what are the imaging findings that we are going to get. Okay, so these are the causes of hypoxia in a neonate. So these are all theoretical points. Okay, so hypoxia can be due to intrauterine factors or postnatal factors. It can be due to fetal factors like feto-maternal hemorrhage or thrombosis, bradycardia, inadequate placental perfusion, impaired maternal oxygen. So there are a lot of causes for that. So this is all theoretical. You can look at it afterwards in your presentation in the PPT that we'll get. Okay, we'll focus mainly on the practical aspects on imaging today, right? So it's another diagram that is illustrating the cascade of events that occur that contributes to brain injury. Okay, so this is again important diagram for writing in your answer sheets during a theory exam. Okay, so what happens is when there is hypoxic ischemic insult, the metabolism shifts from oxidative phosphorylation to anaerobic metabolism, and then this leads to lactate accumulation, right? So this lactate accumulation will lead to presynaptic membrane depolarization that will ultimately lead to glutamate release and activation of NMDA calcium channels. This will lead to calcium influx into postsynaptic cells, which will lead to free radical formation and ultimately mitochondrial injury. Now, this mitochondrial injury will again lead to further depletion of the cellular energy. And with reduced ATP, there will be inhibition of ATP-dependent glutamate reuptake. So this will be a vicious cycle. And then depending on the severity, there can be necrosis or apoptosis. So this is all theoretical. You can remember this and for your theory exams. Okay. So now coming to clinical manifestation, how these neonates will present. So they will have low APGAR scores. Okay. They can have spells of apnea, seizures within first 24 hours of life with abnormal EEG results. Okay. In cord blood, they will have metabolic acidosis. And long-term sequelae, they will depend on what is the severity of injury. Severe injury they will have spastic quadriplegia, and in mild to moderate insult, they will have diplegia, right? Okay, now coming to the imaging pattern. So as far as imaging is concerned, there are four distinct patterns of neonatal brain injury. Okay, so if there is mild to moderate hypotension or hypoxic insults, so in a preterm and term, they will have different appearance. In severe hypoxic ischemic insult, again in preterm and term, they will have different pattern of injury. So these four patterns we are going to discuss in detail today. Okay. Now a very basic concept. Now when there is mild to moderate insult, hypoxic insult, so what happens is, so the brain tries to, or the body tries to protect the hypermetabolic structures. So these centrally located structures are hypermetabolic. Okay, they require more energy and blood supply. So the what brain will try to do is they will divert all the blood. So I'm talking about mild to moderate insult. Okay, so the brain will try to divert all the blood from rest of the brain parenchyma towards this centrally located structures that are more metabolically active. Okay, now what this will do is there will be depletion in blood in the peripheral areas. So what will happen is ultimately there will be injury to the watershed zones. Okay, so whenever there is mild to moderate hypoperfusion or hypoxic insult, there will be watershed infarcts. Okay, we'll discuss that in detail later. Okay, when there is severe hypoperfusion, तो ये जो centrally located gray matters जो hypermetabolic structures है, now these structures will get damaged, right? So the deep gray matter including basal ganglia, thalami, brainstem, myelinated fibers, okay, like periorlandic cortex, cerebellum. So these are the structures that will get damaged when there is severe hypoperfusion. This is a very important concept that you have to remember because all the imaging patterns will depend on this only. Okay. Now, how to remember this, we'll discuss later. Okay, so we are discussing mild to moderate hypoxic insult and severe or profound hypoxic insult. Okay, so when the mild to moderate hypoxic insult is short-lived or acute, less than 10 minutes, so it is usually of no clinical significance and there is usually no imaging sequelae. So this is not important for us today in discussion. When this mild to moderate hypoxia gets prolonged for 15 to 25 minutes, suppose, this is prolonged partial hypoxic ischemic insult. So what we discussed is in this scenario, there is shunting of blood to vital structures. So there is shunting of blood into the central basal ganglia and thalamus. Sorry. And so the injury will be of peripheral or watershed pattern. Okay, you have to remember this. When there is severe insult, short duration severe insult, acute severe insult. So there is acute profound HII. So because of inadequate shunting now, all the metabolically active regions, they will be injured in this pattern of injury. This is called a BGT pattern, basal ganglia thalamus pattern of injury. Okay, this we have discussed. These two we have discussed right now. Key pattern of injury क्या होता है depending on the severity of insult. Now, when this severe hypoxic insult is prolonged, what will happen is there will be total brain injury. Now, in इसमें कोई there won't be any difference in pattern whether we are dealing with a preterm neonate or a term neonate or an adult, because when the when there is severe hypoxic insult and when it is prolonged, then all the brain parenchyma will be involved. It doesn't matter what maturity we are dealing with. Okay, so for today's discussion, these two are important: mild to moderate prolonged and severe acute, because they have different imaging pattern in a term and a preterm neonate, right? Okay, so this is the pattern. This is all these patterns we are going to discuss today. In this sequence, first we'll discuss severe insult in a term neonate, then mild to moderate in a term, then severe preterm, and mild to moderate in a preterm. Okay. So starting with hypoxic ischemic insult in the term neonate. Just a minute. Okay. So we'll discuss now what hypoxic ischemic insult in a term neonate. Just remember this, we are discussing term neonate right now. So starting with severe hypoxia, when a term neonate undergoes severe hypoxic insult, remember this is called a BGT pattern, basal ganglia thalamus pattern, because what we discussed was when there is severe insult, there will be injury to more hypermetabolically active or